Conversations, a group of videos and documents intended to guide you during these uncertain times. This video will provide you with an introduction to some tools to help you with COVID-19. This video and the accompanying documents were produced by the Central Shenandoah Health District. This is an outline of the presentation. We will talk about 5 different COVID-19 technology tools. Before we start, I just want to say a quick note. We're going to explore 2 symptom checker tools. It's important to note that these tools are not substitutes for professional medical advice, diagnosis, or treatment. If you are experiencing any of the following emergency warning signs, you should seek medical care immediately. Some of those signs are trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. This is not a list of all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. The first tool we're going to talk about is the Virginia Department of Health COVID Check Suite. It contains 3 tools, one to check your symptoms, another to find a test, and then another one to get answers. The Symptom Checker is powered by Buoy Health, a third-party company contracted by BDH to power the Symptom Checker. The Symptom Checker asks you to select any COVID-19 symptoms you are experiencing. Once those are selected, it asks you if you're answering for yourself or someone else. Next, it asks for your gender and age. After that, it asks you to provide more details on the symptoms you selected, and then any other symptoms or pre-existing conditions that you might have or be experiencing. When you've completed the question section, it uses an algorithm to recommend what next steps you should take. If you feel like you need a test or it lets you know that you should get tested, the Virginia Department of Health has a tool for that. They have a testing locator, so if you want to locate a testing site near you, select Find a Test. The module lets you filter results based on different criteria, including location, radius from your location, drive up / drive through, pediatric screening testing, and free testing. The Central Shenandoah Health District is in the Northwest region. And then if you have any further questions, the tool has a Get Answers feature, and it links to frequently asked questions about what to do if you think you're exposed to COVID-19, and then any questions that you might have about testing. Next, we have Sarah Alert. This is also a Virginia Department of Health tool. So Sarah Alert is a contact monitoring tool used to monitor close contacts of confirmed COVID-19 cases. Contact tracers enroll contacts into Sarah Alert, which allows contacts to update the health department on their health status throughout their quarantine period. This tool allows participants to report daily symptoms through web, text, email, or robocall. The application logs these reports and allows contacts to be tracked through their recovery. The system will send a daily message to participants that asks about any COVID symptoms they might be experiencing. If participants respond saying that they are experiencing symptoms, if participants respond saying that they are experiencing symptoms, a public health nurse will follow up with them. If you are asked to participate in Sarah Alert, responding to the daily messages is very important. Participation helps the health department better understand the impact of COVID-19 and can help you get the care that you might need. Next, we have COVIDwise, which is also a tool used by the Virginia Department of Health. So COVIDwise is a COVID-19 exposure notification app. The app assists with the contact tracing process. Traditional contact tracing relies on the person who tested positive for COVID-19 to remember exactly who they were in contact with during their infectious period. This app supplements that by notifying those who may have been around the person but were not originally listed. This app is designed to notify users when they have been in contact with other users who have tested positive for COVID-19. This app is built on Apple and Google's exposure notification system that allows smartphones to exchange anonymous keys over Bluetooth. These anonymous keys change daily to protect your identity. If you have the app downloaded, your phone shares its own daily anonymous key and stores the anonymous keys of nearby devices for 14 days. When people with the app downloaded are near each other for a period of time, their phones exchange anonymous keys, and each saves that anonymous key of the other phone. Phones estimate the contact risk using date, time, and duration of contact, as well as the strength of Bluetooth signal, which is used to approximate distance. If you test positive for COVID-19, a public health case investigator will give you a 6-digit PIN to enter into COVIDWise. Your phone will then push out an anonymous notification to those users who are determined to be close contacts. If you are determined to be a close contact, the app will send you a notification alerting you that you are a close contact and will provide you with information on what you should do. This app is available to download from the iPhone App Store and the Android Google Play Store. The Virginia Department of Health never collects or processes any personally identifiable information from the COVIDWise app. Next, we have the Virginia Department of Health COVID-19 dashboards. So the Virginia Department of Health COVID-19 dashboards are COVID-19 data tools. They include information about cases, hospitalizations, deaths, testing, demographics, outbreaks, and more. The tools are interactive, and there are many different ways to filter the data to see information for specific health districts, counties, and cities. The dashboards are updated daily at 10 a.m. with data that's reported by 5 p.m. on the previous day. This tool is the most reliable data source for the Commonwealth and is regularly improved to meet the needs of Virginians. Last, we have the CDC Coronavirus Self-Checker. This is similar to the first tool we discussed and is an interactive clinical assessment tool used to assist users on deciding when to seek testing or medical care if they suspect that they or someone they know has contracted COVID-19, or if they were a close contact to someone who has COVID-19. It's an online, mobile-friendly tool that asks a series of questions and then, based on those responses, provides recommended actions and resources. Links to everything discussed today can be found in the accompanying document. If you have any questions about the content presented today or any other COVID-19 questions, you can email us at cshtinfo@vdh.virginia.gov or visit the Virginia Department of Health website. Thank you.